So our new guidelines state to start colonoscopy actually at age 45, and this is based on multiple different studies showing that younger patients are actually having more early onset colon cancer. And of course, we don't want to miss this because colon cancer is very treatable. So starting at 45 years old, you should have a colonoscopy. The next colonoscopy will be based on how many different things that we see, which is usually what we call polyps. So polyps are what we find within the colon that can become colon cancer. So what we do the colonoscopy, and let's say you don't have any polyps. We will recommend for you to have a colonoscopy again in 10 years. And it is the best possible test that we can do in order to look at screening for colorectal cancer. There is a difference though if you have any type of family history of colon cancer. So for example, if you had a family member, which is usually a first degree relative, so mom, dad, grandma, grandpa, somebody was diagnosed, let's say 45 years old, then you should have your first colonoscopy at 35 years old. Any family history, let's say 60 years old, usually you'll have your first colonoscopy then at 40 years old. So there are some differences, and that's why it's important to always know your family history. Always know if particular people or particular family members have had colon cancer in the past, because it may change when you should have your first screening exam.